According to ATLS guidelines, during the initial assessment in field trauma, Step 1 includes all of these components except A. GCS, B. Respiratory rate, C. Extremity pulse, D. Systolic blood pressure. And the answer is C. Extremity pulse. And the explanation? What is ATLS? ATLS, Advanced Trauma Life Support. The aim of ATLS is to provide healthcare professionals with access to education that will enhance their ability to accurately provide an initial assessment, resuscitate, stabilize, and determine the next steps in the care of the injured patient. Introduction and Initial Assessment. The key of the curriculum that remains the same is ABCDE, that is airway, breathing, circulation, disability, and exposure. ATLS support prioritizing the rapid assessment and treatment of life-threatening airway and breathing problems ahead of circulation problems. For airway and ventilation, the rapid assessment of the airway by determining the ability of the patient to speak and answer questions appropriately, in addition to verifying adequate ventilation and circulation. In ATLS, the 10th edition 2018, drug-assisted intubation has replaced rapid sequence intubation RSI as a broad term that describes RSI and the use of medication to assist with intubation of a patient with intact gag reflex. Regarding shock, shock is defined as or identified by evidence of an organ hypoperfusion present on physical examination. This table 1 shows the classification of shock and the parameter that is used to classify whether patient in class 1, class 2, mild shock, class 3, moderate shock, or class 4, severe shock. The parameter involved is approximate blood loss, the heart rate, the blood pressure, the pulse pressure, the respiratory rate, the urine output, Glasgow Coma Scale, GCS score, base deficit. A negative base deficit usually indicates a metabolic acidosis. Okay, everyone. The initial resuscitation with crystalloid fluid still begins with 1 liter bolus of warm isotonic fluid. Infusion of more than 1.5 liter of crystalloid fluid has been associated with increased mortality. Early control of external hemorrhage, among them is tourniquet is placed above the area of injury. Massive blood transfusion is defined as transfusion of more than 10 units of blood in 24 hours or more than 4 units in 1 hour. Patients with severe shock resulting from trauma can develop coagulopathy from the blood loss, dilution from the large volume crystalloid fluid resuscitation, or hypothermia. A large prospective study demonstrates reduced mortality when tranexamic acid is given within 3 hours of injury. Early monitoring of coagulation and replacement of clotting factors can minimize transfusion needs, especially in patients who are taking anticoagulant medication.